Hey everybody, Dr. Jaime here, and you are about to listen to the Dr. Jaime Show audio experience. I hope you enjoy the tips and advice in this segment. Hey everyone, Dr. Jaime here with the Dr. Jaime Show audio experience. And today I have returning guest, Dr. Mickey Fisher with Florida ENT and Allergy, Florida ENT and Allergy.com. And today we are here to recap the full 60-minute episode that we just had with her on the Dr. Jaime Show, talking about all things allergies and sinuses. Dr. Fisher, welcome back to the Dr. Jaime Show.
Hi, everyone.
Yeah.
Glad to be here again.
Yeah, we're glad to have you. So allergies, I guess in a quick nutshell, what are they and what are some common causes of allergies?
Okay, so allergies are basically your body's immune response to different things in the environment. So basically, when you're exposed to an allergen is one of the things you're allergic to, your body sends an antibody to it, which is recognizing it as a foreign particle that's going to be bad for your body. So basically is fighting what's in your body and sets off this cascade of events that leads to the release of some substances, mostly histamines and leukotrienes, which cause different effects on different parts of your body that lead to allergic symptoms. And so these allergens that you breathe in, some examples are trees, dust, mold, weeds, cats, dogs, feathers, a whole laundry list of things. Basically everything out there you can be allergic to.
Okay, and you guys have to listen to her full 60-minute episode because we talked a lot about the oak trees and what's happening right now because the winter was longer and just a whole bunch of really cool information. She shared some great tips that you wouldn't think about when it comes to allergies, just making sure you change your bed sheets frequently or showering before bed because everything that you put on your body all day is there and then you're laying in your bed. We talk about pets. She says, yeah, you're not allergic to your pet, but you need to wipe them down because they're bringing everything in from outside. And she gives a whole bunch of other tips that we don't really think about on a day-to-day basis. So let's say people have allergies, Dr. Fisher. Are there treatments for these? And if so, can you give us a few options?
Yes, for sure. The first thing would be avoidance. So if you know what really sets your allergies off, then avoid it. You can also get allergy testing to find out what you're allergic to and avoid it. If you do have allergies that are non-avoidable, like trees, dust, mold, weeds, etc., then it's okay to treat them. Start with a saline nasal rinse to rinse out your nose so whatever you're reacting to is out of your body as quickly as possible. First-line therapy would be a second-generation antihistamine. These include, the Zyrtec, Claritin, over-the-counters now, which are non-sedating, but really are antihistamines. And we talked about histamines being what actually causes the symptoms of allergies. And then in addition to that, topical nasal steroids that are now over-the-counter as well, like a Flonase. Those work great.
Okay, and you've got to catch the episode, listeners. We talk about some of the best and worst over-the-counter medications. We talk about using vodka in a neti pot. But we do talk about that, but yes, we don't recommend it. But no vodka in the neti pot, but you'll find out why neti pots work, but why some people at one point thought they were dangerous. And then steroids, do they stunt your child's growth? If you want to know, you've got to listen to that episode. So we'll put a little hook there for them. All right, so now let's talk a little bit about sinuses. So we talked about sinuses and sinusitis. Real quickly, what are your sinuses and what is sinusitis?
Okay, so the sinuses are basically hollow cavities within your head, so behind your face. They are there to, one, lighten your head, so it's not just a big bowling ball on your shoulders. Two, it helps to humidify air that you're breathing in. It also serves as a buffer if you get any trauma to the head. So it's a little space between your face and your brain, basically. In addition to that, sinusitis is when the sinuses become inflamed. And then that can lead to different symptoms of chronic sinusitis and acute sinusitis that we commonly know as a sinus infection.
Okay, and we talked about that on the show and how much pain some people can be in with those severe sinus infections. I know I had one and it probably wasn't nearly to the degree you've seen some people, but it was so painful, got into my jaw. I felt like I had cavities everywhere. So people that are going through this, is there any hope for them? Is there any treatments out there?
For sure. The most important thing is to figure out what the sinus disease is coming from. If it's an acute sinus infection, meaning one that's a one-time thing, doesn't last that long, Then we try over-the-counter medications like the nasal sprays, saline rinses, antibiotics, occasionally some oral steroids. If it's something that keeps coming back, then we need to figure out a little bit more. Do you have allergies? Do we need to treat those first? Do you have any obstructive symptoms, meaning does the anatomy in your nose make it so it can't drain correctly or equalize pressure? We figure that out with a physical exam. We do nasal endoscopy, which is a camera in the nose. We can do a CT scan of your sinuses. And then using all that information, we start you on a course of medications. And if you fail medical management, never fear. There's always surgical options, and that includes, general anesthesia, where we can actually open up your sinuses, fix deviated septums, etc., and also in-office procedures like the balloon that we touched on in our 60-minute segment that can less invasively open up the drainage pathways of your sinuses and really provide some relief for the long term.
Yeah, and you did a great job demonstrating to us exactly how that works. Thank you. I wanted my husband to get the surgery performed right there, but he was not willing. Sorry about that. But you did do a great job, and I love the little tool and sort of looking at it. So Dr. Mickey Fisher, thank you so much for joining us again on the Dr. Jaime Show. We love having you here.
Thanks for having me.
Everyone, you are listening to the Dr. Jaime Show audio experience with Dr. Mickey Fisher, ENT, with Florida ENT and Allergy. FloridaENTandAllergy.com. Do me a favor, go to YouTube, iTunes, Google Play, subscribe to the Dr. Jaime Show. Every like, every follow keeps this show up and running, bringing great guests on like Dr. Mickey Fisher. And review our show 5 stars. Please have a great day and smile with your eyes, and you'll know the meaning behind that if you watch the full 60-minute episode of the Dr. Jaime Show with Dr. Mickey Fisher. Have a great day. Thank you so much for listening to the Dr. Jaime Show audio experience. I really hope that you enjoyed the tips and advice given on today's segment. Do me a favor and go to iTunes and my YouTube, and please subscribe to that channel. Every subscribe, every like, every follow helps the Dr. Jaime Show grow so that we can bring you the best guest and the best content possible. And of course, as always, if you have any feedback, feel free to leave that as well. Talk to you soon.